Thank you everyone for joining me on this Wednesday afternoon for our training today on strategy selection within Reach. So first things first, today's learning objectives are first to briefly kind of refresh on the 7 strategies, give you some short examples just to make sure we all have that basic understanding still. And then we're going to move into knowing or how to know the right strategy to use for your Reach entries. So today is really kind of more of a refresher training for those who already have some of that basic understanding or who have been using Reach. So if you do not feel comfortable, feel free to jump off at any time, or if you want to stay on just to kind of learn more, feel free. But if you do ever have any questions as we go through today, you can either put them in the chat, and if I don't get to them while we're kind of talking today, I will make sure to follow up with an email with you to make sure we get that resolved as well. So now we're going to move on to those 7 strategies and being able to kind of know the difference in the general basic definitions for each. So hopefully this looks familiar to you guys. If you have not seen it before, this is something that we use a lot in our trainings. And it's basically showing you the breakdown of environmental strategies versus individual. And I always like to start out with this slide because I think it's very helpful to talk about what individual strategies are versus what environmental strategies are. And when you guys think of individual strategies, I want you guys to think of more of your whipped cream or the topping of your pie. They're there to provide that little bit of fluff, that little bit of extra oomph to what you're doing, but they're not going to have that overall change on the flavor or the taste of your pie. And the same thing with your community. These individual strategies are going to add that little bit of informational, that skills to those people in the community, but they're not going to have that overall change or impact on the community like your environmental strategies would, which is why I like to think of these as more of your meat and potatoes or your pie filling. They're going to have that overall change and really impact the policies and the procedures and programs and whatnot within your community. So our first strategy we're going to talk about today is providing information. And like I said, we're just going to briefly kind of recover these so everyone's on the same page. And with providing information, this is more of your one-way communication, meaning most, if not all, of your media will probably fall under this strategy when you're entering in Reach. Because things such as your presentations or brochures or billboards, those are all using this strategy of just pretty much getting that information out there for the community to be able to access and have. Our next strategy is enhancing skills, and this is more of your two-way communication. So I want you to think of your providing information as one way, and then your enhancing skills as two-way, so more of a back and forth happening. A lot of times this strategy is going to be used for things such as workshops, seminars, any kind of youth trainings, or maybe a teacher or youth worker training or educational program you might host, as well as any other business or community member trainings. So that is where this strategy will come into play. Our next and last individual strategy is providing support. And with providing support, I often like to think of this more as an alternative or providing an alternative as opposed to or to reduce the amount of substance use in your community. So it can a lot of times be providing an alternative event or activity. Common things are a lot of times, after prom events or maybe after a sporting event thing that you do for the youth. Another popular thing can be a drop-in center, as well as, a recreation program, any kind of support or mentoring groups. And it can also include obtaining funding for equipment or training or a research-specific, or to target, a research-specific or targeted area. Sorry, I did not say that right. But basically what it means is if you obtain funding to specifically support a targeted area like that, that's where this strategy would come into play more. If you have any questions on this or how to go about tracking this more, please feel free to reach out to me or email myself. If this is something you guys have been working on, we can actually kind of walk through this more in depth on a personal basis as opposed to today in the training. So now moving into our environmental strategies. Our environmental strategies, the first one we have is enhancing access and reducing barriers. And this strategy, hopefully you guys know, can kind of flip-flop. It can actually be reducing access and enhancing barriers as well. So common things we see here are providing instructions or trainings in multiple different languages. Maybe you guys work with the local hospital to help provide childcare to people who are receiving treatment. That's another big one we've been seeing a lot of lately. Another thing would be providing transportation to treatment as well. And the biggest one, especially with the huge opioid epidemic going on right now, is the prescription drug take-back events, or distributing prescription drug lock boxes and things along those lines. Those are all going to fall under this strategy as well. Our next strategy is changing consequences, and I like to think of this more as incentivizing behaviors that you want to see and providing disincentives for behaviors that you don't want to see in the community. So the basic thing here to recognize or take away is that a lot of times it's going to just be providing an award or recognition for someone who does something good, and that's going to be an incentive. The other thing could be creating citations or fines for things that you don't want to see, which would be a good disincentive. So common things for fines, maybe fining a local establishment who fails 2 consecutive compliance checks, or, it could be even publicizing compliance check failures. So public recognition can go both ways. It can be used as an incentive or a disincentive, depending on how you use it. Strengthening enforcement and surveillance as well is a really big part of changing consequences. Whether it's you guys supporting DUI checkpoints or the shoulder tap programs, those are all going to have an influence using this strategy as well. Our next environmental strategy is physical design. And physical design is where we are looking at the actual change in the environment or the permanent change of a physical design or layout of a certain area. So the keyword to always remember with this strategy is ask yourself, is this a permanent physical design change? Am I installing a permanent sign? Am I installing a permanent light in this case? Surveillance cameras, things along those lines. Those are all intended to be permanent. Neighborhood cleanup is another thing that kind of plays along here in this strategy. While it might not necessarily be permanent, it is still a beautification effort of your neighborhood, so they do consider it a physical design change. Another thing that a lot of times people don't think of is product placement. So if you're walking through your local liquor store and you see something that probably should be moved because it's maybe too close to the candy aisle or the kids' toys aisle or something, that is another physical design change that a lot of people don't necessarily think of in terms of planning and trying to improve their community. The next strategy we have is modifying and changing policies, and this is our last one. And this is actually a really big one. There is a lot of information on this slide, but the basic thing I want you guys to take away from this one is it's going to be a new or significantly modified change in policy or program or procedure, any of those big P's. So in this case, it could be a new policy concerning price, whether it's an alcohol or tobacco tax fee. In some states, it is becoming legal to use marijuana, so it could be down the road a tax on marijuana. Underage use laws as well. So if you guys work on a possession or under the influence local law, or even if it's a state level law that you've been working on with your local legislature, that can be represented here as well. School policies are another big one. Treatment and prevention laws, policies, and procedures. So this is going to be things like your diversion programs. So if you ever implement a new diversion program, that would be represented by this strategy. Another thing is workplace policies, and this one tends to kind of fly under the radar because it is a little bit harder to do sometimes, but it's always worth taking a look at and seeing if you can work with a local, a local establishment or something to get a workplace policy in place. laws and policies on adult social enabling. So this is going to be your social host ordinance, KEG registrations, and things along those lines. Your laws and policies concerning supplier promotion. This is another thing that sometimes people don't necessarily think of as a new policy or procedure that they can enact in their community, but it is maybe even restricting the percentage of windows that can be covered with alcohol ads or tobacco ads. That is a really good example for this specific type of strategy. Outlet location and proximity or density. Again, a lot of times this one flies under the radar as well, because you can sometimes work with your local law enforcement or your government to get in place some kind of restrictions on alcohol retailers and maybe their proximity to schools or proximity to parks, or maybe it's even the amount of alcohol retailers you're allowed to have in your county or community alone. So maybe you're only allowed to have 5 or 10 or whatever it may be. And then our last one under this strategy here is sales restrictions. And this is basically where you're restricting alcohol selling maybe during specific hours or during specific holiday weekends. Maybe you restrict the hours you can buy alcohol or tobacco. This one can be a little bit harder to implement sometimes, but it's still very effective and a good one to sometimes look at. So before we go any further, I want to ask anyone if they have any questions just before we start diving deeper into examples. And this is, during this next section, it's going to be more polling and stuff because I want to show you guys an example and ask you more what you would select the strategy for this, and then I'll show you what the correct strategy would be. We can kind of talk about that in that sort of way. So if anyone has any questions, feel free to throw them in the chat right now. But now is when we are going to move into this more interactive session with you guys. So first things first, I'm going to pop up an example, so a sample description. So let's say that my coalition, I'm working on entering my data for my coalition, and this is something that we recently did. I have identified it as a community action. So for this one, we're going to say that my staff met with the manager of ABC Liquor to discuss the store purchasing an ID scanner and possibly implementing a new practice requiring employees to scan all IDs. So I'm going to first start with aligning my entry with my logic model. So it's obviously going to be underage drinking, and I'm going to align this with my risk factor of retail access and that stores are selling alcohol to minors. Now, before this next step, I want to kind of ask you guys what you think the strategy should be for this example. So I'm going to go ahead and launch the poll now. So go ahead and select the strategy you would put for this sample description. Excuse me. All right, so we're going to go ahead and close that. So we have 4 people have selected modifying changing policies. 2 of you went with enhancing access and reducing barriers, and 1 of you had enhancing skills. So the correct answer would actually be modifying changing policies. And the main reason for this would be because the intention of this meeting is ultimately to get them to implement a new policy or new practice here, requiring their employees to scan IDs. So that is why you would select the modifying changing policy strategy here. If this description was modified a little bit, I could see you selecting enhancing access, reducing barriers, because you would be providing them an ID scanner. I get that as well. So sometimes it's just being able to narrow your focus in on what the specific action you were trying to accomplish at this meeting. So our next example we have here is for this description where we have a community change. So as a result of my coalition's advocacy, the Sunshine Health Center finally installed a prescription drug take-back box in its lobby. this is the first time the Sunshine Health Center installed a take-back box. So my logic model for this would be prescription drugs, availability, and no disposal locations outside of law enforcement stations maybe. And now we're going to go ahead and take another poll. So let's see here. And let's see what you guys think the strategy should be for this sample description. All right, so it looks like we got everyone in. So we have 5 saying physical design and 2 saying enhancing access and reducing barriers. So this one is a little bit of a tricky one. It's actually going to be physical design for the actual installation of the box. However, you could record this one as 2 entries because you are technically enhancing access and reducing barriers to disposal for those people who do live in the Sunshine Health Center or who go to the Sunshine Health Center. So this is one where it could be both. It just kind of depends on how you're entering it into Reach. All right, so the next example we have is a media example. So this one will probably be a little bit easier. Hopefully everyone gets this one. Not that you guys haven't in the past, but we're good. So our example this time is, let's say that my coalition went out and distributed 30 mental health packets with information and dates for classes and just kind of general knowledge about mental health and things that maybe the school administrators and teachers should know. My problem goal addressed would be mental health. My risk factor is going to be access, and my local condition is going to be potential helpers are not equipped with necessary tools and training. So we're going to go ahead and do the poll again and see what you guys come up with this time. Keep in mind when you are answering this, the main thing I am entering here is my media for just handing out these packets. All righty. Awesome. So we have all 8 people said providing information, and that would be correct. So our strategy here would be providing information. Now, for those of you who are maybe thinking, well, I kind of thought it could be enhancing skills too. The enhancing skills part would come in when I actually hold that class for those school administrators and teachers. So just giving them these packets and information is not quite enhancing skills yet. It would not be that until I actually hold that class for them. So you guys were all right though with providing information. Our next example we have is a resources generated. So I had a coalition meeting and I had 10 of my volunteers and my sector reps come, and we had this meeting at the public library. However, the meeting focused on the need to implement a moratorium on medical marijuana dispensaries in Riverside if proposed medical marijuana legislation was passed. Now, some of you might be thinking this is a little bit trickier of an example. My problem goal addressed in this case would obviously be marijuana. My community norms, or my risk factor would be community norms. Then my local condition would fall under no restrictions around marijuana sales. So if we ended up passing a medical marijuana legislation, in my community, my coalition was talking about at this meeting what kind of policies or procedures or restrictions we can put in place to put some restrictions on who can, have a dispensary or how much they can dispense and that kind of stuff, or how much they can grow if it is about growing. So for the strategy for this one, I want you guys to go ahead and take the next poll. This one I think is another one that's a little bit more complicated. I wanted to get some complicated ones in there today. Okay, so it looks like some of you are not quite sure on this one, which is okay. All right, so it looks like most of you said modifying, changing, that should say policy. And that would be the correct answer. Since it is just a step or a planning or meeting here and we're just kind of talking about it, I I would be okay with providing information too, because it kind of depends on what exactly you were talking about. That's why sometimes there's this gray area with REACH on, and that's a lot of times why we sometimes recommend more information from you guys. And we're like, hey, we need more information in the description to really understand why you selected this strategy here. So that's why I get why one person did say providing information, because if it was just a meeting and you guys were just kind of giving some information or talking about some stuff amongst your volunteers, that's fine. However, in this case, my staff or my volunteers, we were actually talking about implementing this policy. So that's why I would put it under this strategy. All right, so we're going to move on to our next example. And next we have a service provided. And for our sample description here, we have that my coalition, or maybe some of my staff members, went and presented to the Pleasantville School District Board about the need to expand policies to include electronic nicotine services or devices. Electronic nicotine devices. I cannot read today, apparently. We were there to apparently educate the board members about the latest data on youth and behaviors on school grounds. That was a very long description. So we have our problem goal being youth use of electronic nicotine devices, and then we have our risk factor as community norms, and local condition is youth use electronic nicotine devices at school. So we're going to go ahead and take a poll again. So we had 5 of you say providing information, 1 person said enhancing skills, and then we had 2 say modifying, changing. It should say policy. I don't know why it says consequence. So the answer would be, modifying, changing policy. I didn't know it was on the screen. So I get what you guys are saying with the providing information. It is. At a minimum, everything you do is providing information, but sometimes it might also be that it is a different strategy as well. So if it is, you're always going to want to go with that other one because it's going to have more of an impact usually. So while it is providing information, it's also going to be working on or taking a step towards modifying, in this case, our policy to include electronic nicotine devices. So thank you guys. So we're going to go ahead and move on to the next one. I think we have like 4 more left, so bear with me. Our next one we have is another service provided. So this is that mental health first aid training. So I finally got my teachers and my school staff together and I held this training for them. A total of 20 staff and teachers were in attendance and the training lasted 3 hours. So my problem goal is going to be mental health. My risk factor is access, and again, my local condition is potential helpers are not equipped with necessary tools and training. So hopefully you guys all get this one right. We're gonna go ahead and take another poll and see what you guys think for this one. Alrighty, yay, everyone selected enhancing skills, so that's good that you guys all seem like you really understand that strategy, which is good. One less one that gets confused with all the others, if I'm not mistaken. So this would be enhancing skills like I kind of talked about earlier, because you are providing that training for those staff and teachers. So good job there, everyone. Our next entry we have is another community change entry. And for this one, we have that my coalition went and worked with a local translator to translate our underage drinking prevention guide for parents into Spanish for the first time. So this is the first time we have translated, our prevention guide into Spanish. So that's why we have recorded it as a change, because that is something new that we did. My problem goal address would obviously be underage drinking. We have community norms as my risk factor, and then parents providing alcohol for youth for use at home as my local condition. So that's just kind of how my logic model would lay out. So for this one, let's go ahead and take our poll again. Okay, so we have that 7 of you selected enhancing access and reducing barriers, and one person did select providing support. So the correct strategy here would actually be enhancing access and reducing barriers. So most of you did get it right. For that one person who did select providing support, just always keep in mind that providing support is more of your alternative activities or support groups, or like your after school activities, and providing funding or providing funding to help someone support a group within the community. So just keep that in mind. That's okay. Everyone gets tripped up every now and then. I have been doing this for almost 5 years now, and I still get confused sometimes on where to put things, so don't feel bad. Our next example that we have is another community change. For this one, we have, let's say that I held a after-school support group for the first time for my students that have been caught vaping on school grounds at my Riverside High School. So we've noticed that this has become a problem, and they said, just putting them in detention hasn't really been working. What if we create a after-school support group for them and kind of provide them some information, maybe do more of a kind of meeting format and talk with them about why they keep doing it on school grounds, or how we can change this. And this is my first time I held this support group for them. So that's why I recorded it as a community change. Every support group I hold after that first one is just simply going to be a service provided. So keep that in mind as well. My logic model for this one is going to be e-cigarettes or, vaping or something along those lines. My risk factor is favorable peer attitudes. And then my local condition I put as youth are vaping at school. So we had 5 of you select providing support and 2 of you select modifying changing policy. The answer we have for this example, we have providing support. However, this is one of those other ones that kind of double dips sometimes. So if it was, like I was talking about, I went to my school board and said, hey, can we change this policy to making them attend a support group instead of, a detention, that itself would be a change in policy. However, my actual holding of this support group that I'm holding for the youth would be providing support. So that's kind of where I can see where a couple of you put modifying changing policy, which is okay because it could be that on occasions, depending on whether it was that you modified a policy or if it was just that you decided to start holding a support group. All right, so our next example, this is our last one we have for today, is a service provided. And our sample description here is that my coalition went and publicly recognized 3 local liquor establishments that passed their quarterly compliance checks. My logic model here would be something like alcohol. For my problem goal, my risk factor would be retail access, and my local condition would be stores selling alcohol to minors. So this is our last poll for the day. So we're going to go ahead and see what you guys think on this last one. So 7 of you said changing consequences or incentives versus disincentives. And 1 person did say physical design. So the correct strategy here would actually, in fact, be changing consequences. Because remember, I wanted you to think of this more as incentivizing behaviors that you want to see and providing disincentives for behaviors that you don't want to see. So in this case, I recognized 3 local liquor establishments that passed their compliance checks. So this is going to kind of incentivize them to pass their compliance checks in the future or from here on out, because they're going to be like, oh, well, if I don't, I'm not going to get recognized, so it's going to look bad in my business and I'm not going to get a lot of business. Or maybe I could get shut down or something. So that's why it would fall under this strategy. But if you guys do have any questions or this training sparked any kind of in-depth questions you want to have, feel free to shoot me an email. But thank you guys all for joining me, and have a great day and a great rest of your week.